Hello again, everyone. I'm Mark Mazzaferro, Communications and Media Officer for the City of Vacaville, and with us today, as always, is Chris Conception. How are you, Chris?
Happy Monday, Mark.
Happy Monday. It's time for our daily COVID-19 briefing.
It is.
Hope you had a nice weekend.
Yeah.
I pulled
did.
weeds.
Oh, okay.
Put on
That's
my
good.
hat and my mask, and I was out pulling weeds. So
Actually, I took a couple of walks over the weekend trying to stay in shape.
I'm a little sore today, but that's part of the gardening routine, right? It's
There
good
you go.
exercise,
There you
though,
go.
I am told by
Yeah.
my wife. All right, so let's jump into it and talk about the update as of Friday, the last time the numbers were updated.
Yeah, so as of Friday, 4:30 p.m., the number of confirmed cases in Solano County went up to 169. As far as hospitalizations, that went up by 3, so went up from 9 to now there are 12 people hospitalized. Active cases, though, went down by 5, so down to 33 active cases and still 2 deaths as a result of COVID here in the entire county. And Vacaville stayed at 24 cases. The increase in cases were in Vallejo and Fairfield, as well as Benicia.
Yeah, I see that Sassoon City and Benicia now have 11 cases each.
Yeah, they're now reporting over that 10, whereas if you were a city less than 10, they just report less than 10.
Yeah, and I'm not sure about Sassoon's population, but I think this is almost an order of population. Vallejo's the largest city, Fairfield second, Vacaville third, and accordingly, the number of cases fall in line with that too.
Yeah, it's not real proportionate, but yeah, it does fall in line with the populations of the different cities, yes.
So I guess that makes sense. And all things considered, I was looking at the county on their site has other counties listed, and we're pretty low compared to some of our neighboring counties.
Solano County is low relative to the other Bay Area counties where we're comparing to. I think partly because our population is not as much or not as large, and we're probably more of a rural rather than the urban areas.
A little more
San
spread
Francisco.
out,
Yeah.
absolutely. Well, Santa Clara apparently is the big hot spot in the Bay Area, Santa Clara County. That's where they have the most cases and the most serious
Yes,
situation.
yeah, that is, yeah. That I think in the Bay Area they've got the most number of cases in it, as well as the number of deaths also.
Yeah. We mentioned San Francisco, and there are other counties now, and I don't know if we want to get into this discussion, but they're talking about making mask wearing mandatory, but we're not quite at that point yet. Here
Yeah, actually, that's a good it's a good question, Mark, because there was some on we monitor social media, as you know, and there's actually a couple of false claims on social media about Solano County. I think I saw a posting actually where someone posted on an individual page that Solano is requiring masks now and that there's going to be a $100 fine. That is absolutely false. So there is no such requirement. We still are with the CDC, where the Solano County is going by the CDC guidelines, that is recommending a cloth face covering. There is no requirement, although there are, as we talked about last week, there are a couple of stores in the city that are requiring before that's completely up to them. Before you go into their store, that they won't allow you into their store without a mask. But in Solano County, it is just the CDC guideline. It is just a guideline. It is just a recommendation. It is not a requirement, and there is no law, unlike in San Francisco. I think they're going to start enforcing it by police enforcement starting Wednesday, and a couple of other counties that are doing the same thing.
Well, it'd be pretty easy to tell who's wearing a mask and who isn't. So I
True.
guess, then again,
yeah.
do they have enough officers to enforce that rule? Good luck.
Yeah, it'll be interesting. But just to clarify, Solano County and City of Vacaville are not absolutely requiring you. It's just the CDC guidelines. That is, if you are outside and you can't, if you can't socially distance from other people, then they recommend wearing a mask.
Right. Now, you talked to you or someone on your staff teleconferences or Zoom meetings or whatever with somebody from the county every day, correct? Or pretty much every day?
Pretty much every day. I know I have a couple of different conference calls where the public health officer of Solano County is on there. So we are able to ask him questions personally, which is good. So we get the questions from our community, and we're able to directly ask the public health officer from Solano County those questions and get answers to them. And then my staff, we have, our deputy chief sits on different conference calls, with public health as well as emergency medical services, the local agency for Solano County. So, and then also with Emergency Operations Center of Solano County. So we have several different conference calls that we sit on throughout the week.
Okay, let's get to our questions, shall we?
Sure.
Question number one, is the City of Vacaville going around and closing down businesses?
And that is, I'm going to give an emphatic no. We're not closing down businesses. I mean, it's not in our business. Now, obviously, Solano County is under the City of Vacaville and is under the Solano County shelter-at-home order that is in place until April 30th. Right now, we don't know if that's going to be extended because the state order doesn't have an end date, right? But part of that is no non-essential businesses shall remain open. So what we are doing here in the City of Vacaville is if there are non-essential businesses where we get a complaint, those go into code enforcement, and code enforcement then goes out and tries to gain what we call voluntary compliance through education, and so we try to educate the business owners on, the risk of staying open, and let them know. And we also give them some information, reference information as far as small business, and the assistance available to small businesses, because there are a lot of small businesses, unfortunately, that have been affected by this, and we realize that. So we try to give them all the material that's available so that they can hopefully get some help.
And maybe now's a good time to mention that these rules that are in place, these orders that are in place, they come from a much higher authority than the City of Vacaville, don't they?
They do, and a lot of we get comments as far as the City of Vacaville is doing this, City of Vacaville is doing that, and really. What we've said the entire time is, the information comes down from the federal level. We look at the CDC as far as their guidelines and their directives, and those are then get flowed down to the California Department of Public Health, and what the state decides to do with that, and then from there it goes to the county. Solano County Public Health then makes decisions, and the order that we are complying by is actually Solano County's shelter-at-home order.
Right.
And so we are kind of beholden to that until such time that they decide to end that.
So I understand why people are upset, unhappy, angry, and they're angry at us, but it's the classic, don't shoot the messenger. As much as that might sound like I'm deflecting this away from us, we are following the rules based on the best information we have from Solano County and beyond.
We are absolutely following the rules to the best of our ability, and those rules are coming from a higher authority, if you will. And that's not to say that we don't care. We absolutely care.
Yes.
And we realize and we watch every day what's happening in the city, and we worry about it as senior leadership in the city. We worry about it, and as we've told the people before, we meet on a daily basis, and we have long, and you sit in on those meetings too, Mark. We have long discussions as to what we are going to do about certain situations, and we take into consideration everything that we possibly can when we make those decisions.
Yeah, and I think for some businesses, the impact is immediate. They're closed. They don't
Yes.
have customers coming in. They're
Right.
not generating revenue.
Right.
For the organization that is the city, our impacts are going to be a little more long-term.
Right.
In terms of sales tax revenue, property tax revenue, and pick any of the sources of revenue that come into the city.
Yes.
So at some point, it's going to impact our employees, our ability to provide services, hopefully not much, but that day is coming whether we like it or not.
Absolutely, yeah, and so yes, that it has overarching effects on everyone in the community. So you've seen what's been you see the national news, the state news, the local news. I mean, everyone is being affected
Right.
by COVID-19. This is as we've said many times, unprecedented things that are happening. Nowadays have never happened in our lifetimes. The last time anything like this happened was they're making comparisons to the Spanish flu, which was back in the 1918, 1919 timeframe, so over 100 years ago.
Yeah. I think part of the issue too is just the uncertainty of what's going to happen. I mean, during our briefing today, the discussion was city events. Okay, how are we going to handle those? Well, it's hard to plan when you don't know what's going to happen in June or July or August or whenever.
Right. We don't have a crystal ball to tell us what that picture is going to look like as far as the reopening of society, if you will. I wish we knew. We don't think it's just going to be a quick flip of the switch where you're not you're locked in your houses now, and then all of a sudden tomorrow you can go out and do anything you want. I don't think it's going to go like that. But we don't. We have the governor's 6-point plan, as we talked about. That's still kind of vague and it hasn't been implemented. We have the president's 3-phase plan that they keep talking about, but again, that hasn't been implemented, and that's being they keep going back and forth between the governors of the states and the president. So we don't know when that's going to be implemented, and we don't know what it's going to look like. So yeah, we realize that it's affected everybody. I mean, no one is going to come out of this situation unscathed.
Right. Another question, and it kind of contradicts what we mentioned earlier, but is our hospitalizations decreasing? And maybe in a general sense, let's talk about that.
Yeah, so I think the number of, it looks like here, at least in the state of California, there isn't, they originally were expecting like a peak. And they said, had we done nothing, we would have peaked and then come down. And what they've done is effectively, it looks like flatten the curve so that there is really no peak. Then now it's going to look more like, instead of a peak, it's going to look more like a plateau. And so where we are in that plateau, are we early on in that plateau, or are we late in that plateau? We don't know that now. Is here in Solano County, Friday we said hospitalizations went down, but then later in the afternoon, hospitalizations went up by 3. And now the good news is active cases, even though the number of cumulative cases have gone up, active cases are actually going down. So that's good. And we have noticed that active cases have been down for a couple of days in a row here in Solano County. We'll see what today's numbers look like.
Yeah, and lots of articles over the weekend. I probably spent half of my weekend reading different newspapers, different articles, different organizations with any number of ideas about what's going to happen next. I read today there's a second wave, a third wave. We're peaking. We haven't peaked. In Texas, they're trying to open up the economy, but when you really drill down, they're opening up some businesses, but the restrictions are still in place in terms of masks and distancing, et cetera, et cetera. So there's so much information out there that some of it is contradictory, some of it is in agreement, I mean, good luck.
I got to tell you, I have never read so much.
Yeah.
And I don't like reading that much. But I mean, there is, you're absolutely right. There is a lot of information that's out there. And because we're doing these daily briefings and updates to the community, and because, we're trying to get through this, and as far as the city is concerned, and on the emergency operations side, I've had to do a lot of reading and learning about this issue, and there's so much out there. And I just want to let people know that there is so much information out there. Sometimes it gets a little bit confusing, but if you make sure that the information that you are looking at and the information that you are reading is vetted and is valid. Don't just because it's on the internet doesn't mean it's true. You look at the sources. Is it coming from the CDC? Is it coming from California Department of Public Health? Those kind of things. If you're reading a study, which I've read in numerous academic studies on this, has it been peer reviewed, or has it been published in a journal? Those are the things that you need to look for. And same thing, if there's so much information out there, to the folks out there that are watching, please make sure that you're reading and looking at and only believing the information that has been validated.
Well, a common theme, I think, with most of these stories that I've read is somewhere toward the end, they say, of course, we just don't know, or we're still learning, or it's a ever-changing situation. So
Yes.
they add that caveat right at the end. Here's
Yeah.
what I think, but I could be wrong.
Right.
Lovely.
Yeah, yeah, and there is so much. I mean, it is changing on a daily basis. I mean, the information on this. originally they thought that I think the predominant news story in the papers, or in the I should say in the media during the weekend, was that the projections were off. Originally they were saying the numbers of people were going to be in the millions, and hundreds and thousands of. Originally, there was a projection that there was, I think, at the federal level, that there could have been a million or so deaths, and now that's been adjusted down and down and down, which is a good thing. But that's been the predominant story, and even those projections keep on changing.
Well, the danger, I think, with making guesses, and that's kind of what they are, is that if you're wrong one way or the other, you'll be criticized.
Yes.
And
Yeah.
if you're wrong too low, then it's like, well, why didn't you warn us? If you're wrong too high, well, you overstated it and you scared everyone. And,
Right.
And wouldn't it be nice if we could just, as you mentioned, whip out the crystal ball and say, here's exactly what's going to happen.
Right, and there's no way to tell. I mean, that you can compare these to past pandemics, but this virus is going to act differently than those say the Spanish flu back in 1918, 1919. It's going to act differently. It's going to affect different portions of the population as the Spanish flu did. So
All right.
hard to say.
Anything else you want to add today, Chief?
We did make a change. Just want to remind everybody out there, for you tennis players, we do have a bit of good news, and that is we feel like we made a decision as a city that we are going to actually put the tennis nets back up at the tennis courts in the city, and what we are asking everybody is enjoy yourselves, but try to limit it to singles, because that way, you can keep the social distancing. Doubles, you still run the risk of running into each other, and no matter how good you think you are at tennis. And remember that when you're exerting yourself, the air droplets just go out that much. So and that's why it's so much more important for everyone to maintain their social distancing when they're exercising. Is when you're exerting yourself, you're really, the air droplets that you're exhaling actually will go out much further than when you're breathing normally. So good news, but again, we're asking everyone that is, that plays tennis. It looks like we're going to have some good weather coming up here this week. Go ahead and enjoy the tennis courts, but please do so while maintaining social distance so we don't have to take the nets down again.
Excellent. All right, good deal. Chief, thank you very much for the information. And thank you, everyone, for watching. We'll see you tomorrow.